Thanks for tuning in to the Women's Vibrancy Code, a podcast dedicated to helping women move from exhausted to energized, balance their hormones, and feeling turned on by their life, their lover, and themselves. I'm your host, Maraya Brown. I'm a Yale and functional medicine trained women's health expert, midwife, mom, keynote speaker, and self-made entrepreneur. I'm the founder of my signature program, the Women's Vibrancy Code. So sit back, relax, and let's chat about your energy, hormones, libido, and embracing your feminine power. Oh, and you might want to have pen and paper to take some notes on some of these episodes. Welcome back to the Women's Vibrancy Code podcast. I appreciate you. Let's talk about bladder infections. And the question is why this topic and why now? And what I want to say out loud is, as a healthcare provider and a midwife and a woman, I've been serving women for now 25 years. And I find that there are rhythms or batches, so to speak, of topics. And so I remember running the women's health in various places, and there'd be 1 week where everyone's coming in with a breast lump. And then the next week, everybody's coming in with some strange rash, right? And then the next week, everybody's got a new pregnancy. And then the next week, everybody's got cervical cancer. And it would always batch. It's so fascinating. And I just go, isn't this interesting? Like, what's going on in the world? And over the last couple of weeks, the batching has been bladder infections. I've had clients reach out to me. I've had clients reach out to me on behalf of their daughters. I've had questions with posts. And I go, all right, if there's enough people asking right now, then let's just do a podcast episode on this. So first thinking, like, let's kind of dig into what's the difference between a UTI, meaning a urinary tract infection, also known as a bladder infection, versus vaginismus, meaning vaginal pain, versus a yeast infection, versus interstitial cystitis, okay? UTI and IC, urinary tract infection, and interstitial cystitis are often, they're kind of similar, but they're also in symptoms, but they're very different, okay? So a UTI is generally caused by bacteria. I'll dig into this a little bit more. And it's infecting the bladder or the urethra, and God forbid, the kidneys if it goes too long and is untreated. The most common bacteria is E. coli, which naturally lives in our rectum and that area. And so when you're told wipe front to back, it literally means wipe front to back. And if there is cross-contamination, then sometimes that E. coli makes its way up into and around the labia. And if it makes it through your urethra, your pee hole, and up into your bladder, you end up with a bladder infection. So symptoms are generally going to be urinary frequency and urge. Like, it just feels like, oh my gosh, I have to pee. Oh my gosh, I have to pee. But then you'll sit down and maybe not much is coming out. But when it does, whether it's a little or a lot of quantity, it will burn, okay? It will feel painful. Sometimes the urine has a cloudy or strong smelling urine, and sometimes it can be associated with pelvic pain, particularly in women. Men do get UTIs, just as a heads up. Their urethra is longer, but it still happens. And if it really progresses, you might end up with blood in your urine, or the worst would be if you have a fever and it goes up to the kidneys, and hopefully no one is ever going to let it go that far. Sometimes it can be very vague, okay? For women who are older and well beyond menopause, sometimes it can be as vague as you just seem like there's memory loss, or they're just not themselves. And so, particularly women in their 80s and beyond. My husband works in long-term care facilities, and you just think about scenarios where they're just saying, grandma isn't herself. What's going on? And often they can check urine through a dipstick, and lo and behold, there's a bladder infection. Whereas interstitial cystitis is not fully understood, but it's believed to involve a combination of factors, including abnormalities in the bladder lining itself, like an irritation. And sometimes it's associated with inflammation. changes in the actual pelvic nerves. So our brain's ability to pick up the memo, so to speak, and sensations, but it's not caused by bacteria. And with interstitial cystitis, it's characterized by chronic bladder pain or pressure or discomfort. And so often this can be accompanied by a sense of urgency or a frequent need to urinate, only even if it's just a small amount. And so then we go, well, how do we know if it's a bladder infection versus interstitial cystitis? With IC, it's a more chronic. And often it includes pelvic pain, sometimes pain with sexual intercourse. And then once again, it's urinary frequency day and night, but it lasts a much longer time. So the treatment of a bladder infection, I'll dig into that, often antibiotics, but we'll talk about a lot of other things. Treatment for IC, is generally focused on cutting out certain foods like citrus and wine, symptom management, and things that are irritating to the bladder, obviously decreasing overall inflammation, sometimes physical therapy, going to see a pelvic floor PT. There are bladder installations with like actual medications delivered directly into the bladder. There are oral medications. There's sometimes nerve stimulation, in severe cases, surgery. And with IC, there's a lot of bladder training involved. Okay. Whereas vaginismus, like one of the women, her daughter was in college and going, is this a bladder infection? I don't know. For her, it seemed like the pain was more intravaginal, not necessarily urinary frequency or burning. And then we go, oh, okay. So then there could be something else, right? So UTI is generally always going to be associated with urinary frequency, urgency, and burning. And then yeast, sometimes it can be so irritating. It can also cause urinary burning when you urinate, or pain. Same with if someone has a herpes outbreak, to be honest. But with yeast, what I'm talking about is it can create so much irritation, but it's generally going to be associated with itching and a very distinct discharge. So I can already tell this episode is very intense. We're like TMI for those of you that are like, wow, I wasn't ready for this. Let's dig in. Okay. So, bladder infections. Like I said, the most common cause of a UTI is E. coli, and it gets in through the urethra and can multiply once it's made it into the bladder, and that leads to an infection. So some of the things that we think about regarding cause, sexual activity. So anytime you're having sex, really, truly go pee afterwards, okay? Because just simply the movement, the friction, the touch in different places can introduce bacteria into the urinary tract, which can increase the chance of a UTI, especially in women. And this is often referred to as honeymoon cystitis. And obviously, bladder infections are more common in women that are sexually active. And for those of you in my space, I love to help women feel turned on by their life, their lover, and themselves. And often that means more libido. And so this is a relevant topic. Sometimes there can actually be urinary tract obstruction, such as kidney stones. If someone has an indwelling catheter, there can be anatomical abnormalities, and all of those are going to increase a risk of a UTI because the bladder can't fully empty. There's also something known as weakened immune system cause of UTI, right? So individuals with compromised immune systems, autoimmune conditions, if you're someone who gets sick often, if you have diabetes, if you've been diagnosed with HIV, or you're undergoing chemotherapy, these are all things that are going to make you more susceptible to infections, including bladder infections. And they're no fun. If you have a bladder infection, you're generally going to know and you'll remember it. I've had one in my lifetime, and you betcha I remember it to this day. And I was like 19 years old, I think. It was no fun. From a hormonal perspective, as hormones are fluctuating during pregnancy or into menopause, even throughout the menstrual cycle, this can alter the vaginal environment, the vaginal flora, and make women more prone to bladder infection. So as an example, as a woman crosses over 35 and into her 40s and 50s, and her estrogen level starts to drop, that tends to degrade the integrity of the pelvic floor, the pelvic tone, as well as the tissue integrity. As estrogen goes down, so does collagen. And so often as women progress through menopause, one of the side effects can be more reoccurring bladder infections. And it really is associated with estrogen. Let's talk about prevention. So if we want to prevent bladder infections, the first thing I want to say out loud is hydrate. Hydrate like it's your job, okay? Every day, every week, every month, every year, for every individual listening to this. People say how much? A bare minimum of half your body weight in ounces. That's of water, or water with electrolytes. I was on a group call today and one of my clients was like, well, I drink my adaptogen elixir every day and I have my teas. Does that count? I'm like, no. I'm actually saying water or your electrolyte water. If you are drinking tea or coffee or your adaptogen elixirs, that's in addition. We really want to hydrate. It's going to keep our brains working, our detoxification working. It's going to keep our bladder being cleansed. Okay. Practice good hygiene. I already mentioned wipe from front to back all the time. Okay. I want you to refrain from douching. Okay. If you're going to clean in your outside your labia and in around your vulva, only use water. You're welcome to use soap around your anus, but no douching. Okay. And like I said earlier, make sure you urinate after sexual intercourse. For those of you that are engaging in anal sexual intercourse, then we really, really, really need to focus on cleanliness, proper toy cleaning, all of that. I'm not going to get into that right now, but hygiene really is an important one. And none of the fragrance wipes, okay? Just regular toilet paper, front to back. Avoid holding your urine. So if you're someone who tends to hold it, maybe you're busy with work or I don't know. I just want to say avoid holding it for long periods of time. It can actually increase the risk of bacterial growth in the bladder. Okay. When you're hydrating well, it means you're going to urinate often. That's okay. It's how we get toxins out of the body. We pee them, we poop them, we sweat them out. Okay. Some say opt for showers over baths. I love a nice, hot, long bath, but I want to clean the bathtub, right? So if you're someone who's prone towards bladder infections, maybe consider doing more baths. Taking more showers instead of baths, and that could reduce the risk. And the same thing when we think about hot tubs and pools, right? You just think about, how can I decrease exposure? Wear breathable clothing. So choose underwear made from breathable fabrics like cotton. Avoid tight fitting clothes. Right? Sometimes women will come in and just bladder infection after bladder infection. I'm going, what's going on here? And they tend to wear really tight fitting jeans. So we want to create a nice flowing environment. We don't want warm, moist, tight. Okay. So then on with that topic, we want to stay away from sugars. Okay. In general, if you're someone who has been getting bladder infections, it may be a warning sign for you that you are simply eating too much sugar. And sugar can come in the form of simple carbohydrates like crackers and chips and that kind of thing. Sugar can come in the form of alcohol. And then obviously your donuts, your cookies, your candy, all of that stuff. Just cut it out. And that can sometimes make a really big difference in helping your body be more healthy, right? And it's also going to decrease that overgrowth of bacteria because bacteria feeds off of sugar. Okay. Practice safe sex. Use condoms to reduce risk of sexually transmitted infections. STIs can lead to UTIs, so keep that in mind. And like I said, pee after you have sex. Okay, avoid irritants. I already mentioned that regarding like the perfumed wipes, but also sometimes spermicides, feminine hygiene sprays can be super irritating to the urinary tract. I already mentioned, please, no douching. Okay, no douching. We want to maintain our vaginal microbiome. And then just maintain good health overall. So eating a balanced diet, getting your fruits, vegetables, and berries every day, ideally every color every day. Food coloring and M&Ms don't count. Can you sit down at every meal and say, okay, I have a minimum of 3 different colors, and your white, your yellow, and your brown don't count, right? We're looking for a diet rich in plants. We want to have good hydration, decrease our sugars, decrease our alcohol, and for some, decreasing caffeine. Getting regular exercise, managing stress, getting enough sleep, all of those things are going to contribute to overall health. And then if you're ever wanting some functional tests like a GI map to look at your gut microbiome, or a Dutch Plus test to look at your hormones and your adrenals, you can always reach out, and me and the team can order those tests for you and make sure that one of us who are experts in that test specifically can review it for you and help you see, okay, where is the inflammation? What is going on here? If you feel like you're predisposed and you're having recurrent vaginismus, yeast infections, UTIs, IC, any of this. You may consider probiotics. So probiotic rich foods are going to introduce the beneficial bacteria and sometimes help prevent bladder infections by promoting healthy balance of bacteria in the gut and the urinary tract. What are probiotic rich foods? Your yogurts, any sauerkrauts, kimchi, any of that kind of thing, miso soup, tempeh, yogurts and kefir, kombucha, as long as it's not too sugar loaded. Those are just a few off the top of my head. And then keep in mind prebiotic rich foods. Prebiotics are going to go in and help the good bacteria do a better job at what it's intended to do. So your prebiotic rich foods are fiber rich, also known as oligosaccharides. So your artichoke hearts, your beans, your garlic, onion, your leeks, the lentils, the things that are really fiber rich, they're going to go in and help those good bacteria do a better job as a way to prevent a bladder infection. Let's talk through treatment. So obviously the first line of treatment, if you go in and you have a bladder infection and you see your provider or you go into urgent care, they're going to want to prescribe you antibiotics. When you pee in the cup, they can do a quick dip and see just that way if it looks like there's a bladder infection. They'll look for ketones, nitrites, bacteria, but they can also send it away for a more thorough test that shows what antibiotics the bladder infection may be resistant to. And so the ideal is we want to get if you're going to go on an antibiotic, you want the one that is most specifically associated with the bladder infection that you have. Okay. So maybe they'll put you on Cipro, which is a really broad spectrum antibiotic, and it, yes, is going to kill the bladder infection. But along the way, it's also killing all of the good bacteria and can take anywhere from 6 to 12 months for your gut microbiome to recover. Whereas maybe you can go on Macrobid, which is specific to a bladder infection. It's not so broad, it's not so powerful, but tends to really help the bladder infection go away. So to make sure you're going in with self-advocacy and saying, I want the antibiotic that's going to work, but I also want to do my best to maintain my own gut flora. Outside of antibiotics, cranberry juice is one of the big ones, right? But it's not cranberry juice. What you're looking for is cranberry concentrate. You can dilute it, mix it with water, or get cranberry supplements. Cranberry products contain compounds that may prevent the bacteria from adhering to the walls of the urinary tract, reducing the risk of infection. There's some women that I know that will get cranberry supplements and they just take them prophylactically every day as prevention for a bladder infection. Or like I said, you can get an unsweetened cranberry concentrate. And just if you are having symptoms of a bladder infection, drink it a lot. Okay. If you are feeling like you have early signs of a bladder infection, I mentioned probiotics from a prevention perspective. They're also going to help potentially as treatment because the lactobacillus are really beneficial bacteria that can help maintain the balance of microorganisms in the gut as well as the urinary tract. And so adding in probiotic rich foods is always going to be beneficial. Does that mean you go out and you get a probiotic? I'm actually not a big fan. My preference would be that you get a GI map to really look at your specific gut microbiome, let someone from my team review it. That's their specialty. And then if you are going to go on a probiotic, it's specific to your specific scenario. And so I already mentioned a bunch of probiotic rich foods, good to go. Okay, another supplement that I think is worth mentioning is called D-mannose, D-M-A-N-N-O-S-E, and as in Nancy. D-mannose is a type of sugar that may help prevent bladder infections. It also prevents bacteria from adhering to the urinary tract walls. So women will take it as a supplement or consume foods rich in this specific sugar, such as cranberries and blueberries. And it can help alleviate the UTI symptoms and also promote urinary tract health. And so I definitely have worked with a number of women that take it prophylactically as prevention. Vitamin C is one worth mentioning. Make sure it's liposomal, but if you feel like you're getting early signs of vitamin C, you're going to hydrate like it's your job, right? We want to really clear that out and add in some liposomal vitamin C up to like 5,000 milligrams a day, as long as it's not giving you diarrhea. Adding in that cranberry, adding in the D-mannose is going to be great. Ironically, corn silk is another one that is like old wives' tale. I remember being, I think I was in Nicaragua working with the mountain midwives there, and they would take, like if you get corn on the cob that still has the skin on it, you pull the skin off that silk that's between the corn kernels and the husk. That's corn silk. And eating it is actually preventive and supportive of bladder health and great for bladder infections. Okay, talking about herbal remedies, I just figured I would talk about a few. Uva ursi and golden sil are probably the top two. You can often get like over-the-counter bladder support, and you're going to find uva ursi and golden sil in most of them. Great for immune support, great specifically for the bladder, great as antibacterial. And I think the last thing I just want to really highlight is hydrate, right? All of us need to hydrate on a regular basis, both as prevention, as bladder support. It's going to help our overall well-being, our skin, our nails, our brain function, our body's ability to detoxify, our body's ability to maintain temperature. I mean, there's so much that I could say about the benefit of hydrating with water. And sometimes adding electrolytes to that water. And then if you are having symptoms of a bladder infection, just really do a big dose, a big burst of hydration. And then don't ever underestimate the potency of going in, be seen, go to urgent care, get your urine dipped. Okay, it's better to know. The last thing you want is for that bacteria to travel up through the bladder and up into the kidneys. There's something called pyelonephritis. You'll end up hospitalized, IV antibiotics, really not fun. Okay. It's one of those scenarios that you really do want to prevent. And so, I'm not a big fan of just willy-nilly going and taking prescriptions. But if you have a bladder infection and you've, taken a day, even 2 days to see if you can nip it in the butt yourself, you don't have a fever, give yourself that leeway, maybe. But if the symptoms are really hurting, and especially if you're having any flank pain or your temp is starting to go up, it's no joke. Go in, get seen, go on the antibiotics. Just know that you're going to be on a 6 to 12 month recovery after the antibiotics are done to help your normal, healthy gut flora respond and recover. And it's all good, right? It's all good. We can recover. You can always come work with me. We'll order a GI map. You can work with the team and we'll be there to support you. But I just felt like, okay, let's at least do a deep dive into bladder infections, UTIs, and hopefully this has been helpful for everybody watching. For everyone watching live, hello, hello. For everyone listening in the Women's Vibrancy Code podcast, I appreciate you. If this feels like something that you have a friend that would benefit from hearing, please share the episode. Please give a review. I do read them and I really appreciate reading them. And may we all have clean bladders and no bladder infections, even as we progress through perimenopause, menopause, and beyond. All right. Ciao, ciao.